We're going to be talking about x-rays today, guys. So we're at the front desk. Here's our amazing office manager, Liz. And we're going to head back to the x-ray suite. We got Haja behind the camera, so let's come on back. Hope everybody's having a good holiday season. I'm kind of whispering because we have some massages going on in here. So it's kind of busy this morning, so we're going to head on back. The x-ray suite's back here. Here's one of the open massage and acupuncture rooms. So we have chiropractic, acupuncture, massage, but this is our x-ray suite back here. And I wanted to talk today of why it's important to get x-rays sometimes. So that's one thing people like here is you don't have to go to the hospital. You don't have to go to, urgent care and imaging center if you need x-rays. A lot of insurance will pay for it. So it's boom, get an exam, come in, get your x-rays and figure out what's going on. So let me just show you a few reasons of why it can be important to get x-rays. So let me actually go back to this one here. So some people wonder, gosh, why am I having headaches? Why am I having neck pain? They've had it for years and years. They've tried prescriptions, they've tried different diets, and they can't figure it out. Well, a lot of people, this is somebody in their 20s that woke up daily neck pain, daily headaches, and they actually have a reverse curve in their neck. People call it text neck. So looking down, texting, not using the right pillow, being on the computer all the time. And so the cool thing about her is she, didn't have a bunch of arthritis, anything like that. And after 2 months of treating, we actually totally fixed her neck curve. She has no pain. She actually was like, oh my God, that's my neck. It's, that much improved. So that was a pretty cool one. But how do you know what's going on unless you can see your bones and, what's going on here? Now, some people that maybe are a little older, they've had trauma to their neck. Here's another one, but you can probably see that there's some arthritis here. So we know we're dealing with arthritis, some disc degeneration. There's a lot going on there, and without X-ray, we don't know those things. Um, and we actually ended up getting an MRI for this patient because she was having arm pain, but she's vastly improved. But this is kind of where we started, knowing what the problem is. Let's see, here's somebody with scoliosis. So a lot of people don't realize, why am I having pain between the shoulder blades, lower back pain? They might have scoliosis. Now we can give them proper stretches, home exercises, maybe decompression, give them massages. So we can just, once we actually know what's going on, we can give them a way better treatment plan. Let's see what else. Sometimes we find bone tumors. So you can probably see here, that definitely looks different than that there. So this is somebody that was coming in for back pain, hip pain, and we found this, and obviously she had to go to a specialist for that, but thank goodness we probably prevented a huge problem from happening down the road. And here's actually another one. This is in someone's humerus here. You can probably see where that arrow's pointing, another hopefully benign tumor, but we never would have found this, never would have figured it out with imaging, with x-ray. Let's see, we'll end on this one. So a lot of people have disc degeneration. So their bones, your bones have a jelly-like disc between them. That's kind of the shock absorbing mechanism in your back. Well, sometimes that can wear and tear out. And Haja, if you can kind of zoom in on what's circled there on the left. And this was somebody in their late 20s, early 30s. That should not be like that. It should be like this. This is normal on the right. So in that case, now we know, hey, we should be doing some decompression, maybe an inversion table at home. So hopefully you can see the power of getting x-rays and not just kind of guessing what's going on, but actually knowing, what your diagnosis is. So we'll continue with more education pieces here, but hopefully that helps.